Now, one of the major issues affecting women in Marsabit County is inadequate access to maternal health services and information due to the vast nature of the county and nomadic lifestyle of some of its residents. Now, a woman from Moyale sub-county is hoping to turn the maternal outlook of this county by leveraging technology that brings these crucial services to expectant pastoralist women and by ensuring they attend antenatal clinics. Our reporter Gloria Milimu was in Marsabit County and filed the following report.
As one travels across Marsabit County, you cannot fail to notice its sparse population and vastness of the semi-arid lands dotted with pockets of temporary homestays erected by pastoralists. Compounded by cultural beliefs and unpredictable weather patterns, this vast county provides a distinct health challenge for its expectant mothers and their unborn babies. But one woman is seeking to turn the tide on this worrying health challenge through the use of technology.
They say digital technologies can offer an opportunity to improve maternal health outcomes. Here in Moyale sub-county, a 40-year-old woman is bridging the gap of access to quality maternal healthcare services by linking pastoralists to healthcare workers through a GPS platform.
So we are encouraging them kindly.
Dahabo Adi Galgalo, a medical laboratory scientist from Moyale sub-county, leveraged the use of GPS to track expectant women from her community to ensure they do not miss the crucial antenatal services. What started as a dream in 2017 now holds a promising future for the county's maternal health indicators.
Through some data analysis, we came to establish that most of these expectant mothers, these mothers who are dying, they are from the pastoralist community. So these are the people who are keep moving with their animals to search for pasture and water. And sometimes this population, they usually travel even at the extent to go to Ethiopia or even the side of Somalia.
Through their findings, Dahabo and her team came up with a gadget that facilitates enhanced location of these women who ordinarily would miss out on life-saving antenatal care due to proximity to health facilities.
The total number of beneficiaries that were able to benefit from this project were 237 expectant mothers. So from these 237 expectant mothers, when we first took the baselines data to establish whether they have ever gone to clinic or whether they have ever ever gone to antenatal clinic to get that service, almost 78% they have never attended this clinic in their previous pregnancy.
It brought these crucial services to the expectant mother's location, creating an impact on maternal care.
With this one, at least we were able to increase the uptake up to 80%. From that 0 up to 80%. So we noted increase in the uptake of antenatal care. We noted the increase in also postnatal care and also partly immunization within that population for 2 years.
The GPS device, she explains, is fitted onto a beaded wrist bracelet that resonates with their culture. It then relays signals to satellites, which then relay the signal back to Galgalo and her team via a web-based application.
80% of the population within Marsabit County are pastoralists. And within this community also, you can't get a sort of electricity network within this community. By using the mobile phone, you can't reach them. So that was the reason that we decided to come up with the GPS. So what about if we can able to give them the GPS tracking system so that we can monitor where they are?
According to Moyale Sub-County Referral Hospital Superintendent Dr. Ibrahim Kontoma, culture impacts heavily on maternal health in the sub-county.
The uptake is low because of the nomadic nature of the people here. And the people also, the cultural issues also influences. People prefer to deliver at home with a traditional birth attendant.
Tumekaa sana wakati watoto walikuwa miaka 2 years, tunakuja tunachukua hao watu wanachukua wakaendanga na watu wengine wanaogopa sana. Watu usiku hata ukilala watu wanaona nyinyi usivae, lakini tunachukua tu.
The facility conducts at least 200 deliveries per month and over 30 cesarean section deliveries, making it a relatively busy facility that not only serves residents of the sub-county, but those from the neighboring Wajir County and even Ethiopia. The GPS tracker also increased immunization coverage of children, apart from boosting skilled deliveries and early screening for pregnancy-related complications.
It improves, the access. We are talking about universal healthcare. So universal healthcare is about access. So this particular project improves accessibility by reaching down to people who are on the ground. I think there is an improvement among the populations which was done. It was at 78%. So there is an improvement in ANC uptake to increase the number of visits. And then, the number of visits has also has an impact on the health outcomes, because there will be an early detection of pregnancy-induced hypertension, infections. So it increases outcome. So from 60 to 78%, that is it is a project which has an impact.
Galgalo and her team are now looking to improve the GPS tracker to include an SOS button that will enable swift response to the expectant mother's needs in the event of an emergency.
With intervention of, we have intervention at community level, community health workers, at least we could be able to reduce maternal mortality. But what is still very high is the neonatal and perinatal mortality rate. So we have perinatal mortality rate is very high still. So one of the contributing factors is home delivery.
Blood group, then they look at urine and
Gloria Milimu, KTN News.
Blood sugar have been tested.